I am Dr. Arun Bhanot. I am working as the Chief of Spine Surgery at Paras Hospitals, Gurgaon. At Paras Hospital, Gurgaon, we are running a dedicated spine surgery department. Many of the hospitals in Delhi and NCR are catering to spine as a part of their orthopedic or neurosurgery practice, but here in Paras, we are providing spine surgery as an exclusive specialty. We have a team of 3 spine surgeons led by me, Dr. Sandeep and Dr. Nipun are a part of my team. And we are all dedicated spine surgeons working in this field for about 10 years now. At Paras, we are, and as a spine team, we do not deal with anything else except spine. So our focused area of interest is spine and the best of care in this field. At Paras, we are providing all the basic as well as high-end services for all types of spine care. It starts right from conservative treatment for spinal patients, the best of conservative treatments wherever they are requiring medical and rehab treatment, we cater to that. And then we graduate to the injection treatments when the medical treatment doesn't work. Our team takes care of the spinal patients by giving injections in the spine at various selective points where many a times patients spinal problems, the origin is not clear, so here the injections come very handy and we can selectively block one area to identify the source of patient's pain. Thus our spine team is able to provide the most specific diagnosis and further treatment according to the diagnosis achieved. We have an in-house diagnostic facility, a high-end MRI, CT scan and other facilities to diagnose. So all these things help us to achieve the best of possible diagnosis in a particular patient, especially when patients are not able to get a clear diagnosis and treatment of their spinal problems, especially the back pain, the neck pain or the sciatica pain that goes down from the leg, from the buttock to the leg. We also deal with spinal deformity where patients, especially young girls, they become curved, their spine instead of remaining straight that tilts towards the side or tilts towards the back, and they look quite grotesque or they look a little abnormal and have a low self-image. So we can correct those patients also safely these days. Earlier these were done only in very high-end institutes, government hospitals, but nowadays we are able to do these surgeries here in Paras very safely and very effectively. Apart from dealing with all types of spine surgery that range from upper cervical spine to dorsal spine to lumbar spine, where the patients have problems like slip disc, patients have problems like lumbar canal stenosis or cervical spondylosis with pain going down the arm or both the arms, or patients are not able to stand and walk properly. They are feeling giddiness or imbalance in gait, so they can be, if they are found to have the problem in spine, they can be safely treated. Age is nowadays no bar. Earlier people used to think that after 60, after 70, how much life I have got and there is no need to try getting operated for spine, and they would live a very compromised lifestyle, like they would not be able to get out of the house, just going from their bedroom to the washroom or going to the kitchen and then coming back, restricting their life very much. Nowadays, we are able to operate these patients even at 70, 80, and the last age which we have operated a patient is 90 years old, and he is able to get the benefit of the spinal surgery. For the last 3 years, he is comfortably walking after remaining confined to bed for 3 months before the surgery was done. The unique service that we provide at Paras is the keyhole endoscopic slip disc surgery. Many patients of spine, most of the spinal problems are actually slip disc problems. So these happen in 2 age groups, mainly younger people who are confined to desk jobs and the older people who can suddenly wake up with a slip disc. So these patients are suffering a lot because of the pain that affects in the back as well as going down the buttock or both the legs, and sometimes causing numbness of the leg and weakness in the foot or inability to walk properly. So these patients are always running away from getting operated and suffering, living a poor quality of life. Sometimes they do get better over a period of 3 to 6 months to 1 year, but they have lost a lot of good quality of life and precious productive time of their life. So these patients are basically not availing for surgical treatment because of the fear of surgery. People think that spinal surgeries usually lead up to patients getting confined to bed. It is not true. It is other way around. most of the spine surgeries, if properly chosen and correctly executed, actually can give a much higher success rate, upwards of 90%, whenever they are intended properly, chosen, picked up correctly, and then done in the same correct fashion as they were designed to be. So for those patients who are running away from surgery because of this fear of getting paralyzed or developing some nerve damage, because people think that the nerves are very delicate and in spine surgery the nerves cannot be touched. If you touch them, they will get paralyzed. For these patients, our specialty of keyhole endoscopic surgery, which we do under local anesthesia, the benefit is that the patient is awake during surgery. We give a small amount of local anesthesia and a little bit of sleep-inducing medication. So the advantage is that if the surgeon happens to touch the nerve, the patient will feel that there is something touching the nerve, so the surgeon can correct his path, and that will ensure that the nerve of the patient does not get damaged at all. So this induces a lot of confidence in the patient's mind that yes, if I undergo a keyhole surgery, my nerve is not going to get damaged. The other benefit is, because the cut is so small, about 7 to 8 millimeter, there is hardly any long recovery time. Actually, the patients can get back to their work within a couple of weeks after undergoing spine surgery. Many a times patients come back to tell us, "Doctor, I hardly feel like that I have got operated. I am so good after the surgery." And this is one surgery which is unique to Paras. Not many hospitals, not to talk of Delhi NCR, even in North India, not many hospitals are able to perform this particular surgery, which I have personally learned from South Korea and USA, and have been doing it here for the last 6-7 years, in fact 8 years now. So this is which is special about spine surgery at Paras. Besides that, because it's a team approach, most of our patients, when they are admitted and admitted for surgery, all those patients are seen by a team of the spine surgeons. So they get the benefit of 2 to 3 consultants looking at that patient and giving their opinion, so that the best of the diagnosis is given for the patient. And once the diagnosis is correct, the pain source is correctly identified, the doctors can manage it in a minimally invasive fashion. Instead of opening the whole of the spine, he can do a focused surgery, just looking at the most important cause of the problem. So this reduces the trauma related to surgery and further improves the recovery time for that patient. Even older people, 60-70 years, after getting their spine operated, even when we have to put in some screws and rod along with removing pressure, they can get back to started walking. They can get back to start walking within a couple of days after the surgery. So this is something which is very unique for the patients to experience. Mostly people will come and ask how many months of bed rest is required after spine surgery. Nowadays, I would like to tell, there is hardly any number of days of bed rest, just a couple of days depending upon the patient's pain after the surgery. They are able to stand, walk and move around comfortably.
That's great.